been a chiropractor for a long time, since 1988, and began continuing her cranial studies in the biodynamic method in 1998. And Kate and I had the pleasure of assisting Shariona in a training together way back in 2006 in Nelson, BC, where we became good friends. Kate stayed with us, and I've stayed at her house a lot in Vermont. And she just showed me these amazing pictures of this building she's bought for her school. So her school will now soon have a permanent home in this wonderful new building in Massachusetts, right? It's in Massachusetts. So how wonderful that she's going to have a home for her cranial school. So it's with a lot of pleasure that I introduce Kate. Come on up, Kate.
Thank you. Okay, so I coerce my clients into craniosacral work a lot, talk them out of why they think they're coming to see me. So I've been practicing. I've seen a lot of people in accidents. I treat a lot of the contact improv dance community. I don't know if there's any dancers in the crowd here today, but yeah, and they tend to drop each other. So they're amazing, fun people to work with, but you know, it stems from they'll take a person and throw them over their shoulders, and sometimes they fall. So also bike accidents, and what happens a lot in my practice is that people come to me at the end of the road, because right now concussion centers are really popular, and it's kind of like in vogue right now. Hyperbaric oxygen chambers and all these different types of practitioners are creating these concussion centers. And I just want to speak out for us, because we've been doing this work for a long time. And I think that our work is one of the most effective ways to work with concussions, and I'm going to talk about why. So sometimes it's, it's a little difficult when you get someone who's had post-concussive syndrome for 2 years and you finally get to see them. And you're like, darn, I wish I'd seen you, a week after. But maybe as we do the work more and get the word out more, if you want to take things from the PowerPoint and talk to practitioners in your area about the work you do, please do that. So concussions are also called traumatic brain injury, okay? Same thing. And they're a lot worse when a person hits their head and there's a rotation involved. So they're in an accident and this way, or sports that I cannot watch as a cranial practitioner are football, rugby, and boxing, because when you know what's going on underneath, it's hard to watch those kind of things. So these forces, when a person hits their head, they go down to the center of their brain, and that can influence the corpus callosum, which connects the right and left brain. Okay, so that's just a good thing to kind of understand with the injury. Chronic traumatic encephalopathy, which is a big word like our profession, it's often these people, they're finding that when they have multiple traumas, like they are playing hockey and they hit their head and they take them out of the game, and then they put them in the last 5 minutes and they hit their head again. It's a lot more, when that happens too many times, that's when you get chronic traumatic encephalopathy. So, it's the sad story of the tissue in the center of the brain can die off, and you can get extreme symptoms. That's what some of the movies have been about that have come out about football players and some of the things like that. There's a good picture here coming up. So here's a picture of a person being hit, and you can see how what happens to the brain, especially the middle one here. You can see the impact is here, and then that puts like a twist in the head. So switching over to the symptoms, one good thing if you want to find out if someone has a concussion is can you count backwards from like 1,000, 999. That would be hard for them. Or do you remember what you had for lunch yesterday? I mean, that's hard for me too, but you know, questions like that. So they can be a bit foggy. They can confuse events. You can ask them questions about who our president is. I don't know if you want to do that, but you can, you know, they have trouble answering your question, things like that. Headaches, nausea, vomiting. My brother had that when he was, when I was a kid. We lived in India, and they had drained the pool, the embassy pool, a foot, and he dove in. Marky was about probably 11 years old. He had to go to the hospital because he had nausea, and he was vomiting, and so he's doing good though. You can get dizzy from them. That's a big one. Dizziness or vertigo, where the room is spinning around you. You can have sleep, you can't sleep, or you can sleep too much. And emotionally, you can be pretty unstable and you can have bouts of crying or anger or just feeling, you know, really unsteady on that room. So after a traumatic brain injury, a TBI or concussion, basically where we would be really helpful is this autonomic dysfunction happens. The meningeal system tends to get deformed. It can get twisted in 49% of patients. That's pretty powerful. Fluid flow can be an issue. The CSF or the venous fluid or the arterial fluid. Debris can build up. We're going to talk about the lymphatic system and the venous system. With chronic traumatic encephalopathy, you can call it CTE, a lot of debris gets built up in the brain, and that debris has to find a way out. And that's where the breath of life can really come in and support that. One thing too is that when we bleed, that brings in quite a bit of inflammation. So if there is any bleeding in the brain, because there is a lot of microvasculature, capillaries and things like that, that starts to cause inflammation. It affects your memory, axons, the axons that come off the neurons, they do not like being stretched. So I have a really good picture of that coming up. Protein tangles can happen, they're called tau. And there's a lot of inflammation from the debris, and so on and so forth. So the axons do not respond very well to stress. And you can see all these chemical aspects being discharged, and those need to be cleaned out. And we're going to find out how they get cleaned out by this lovely cell called the astrocyte. It's a great name, isn't it? Astrocyte. So here's some clinical proof of what happens. Here, very interesting. This is pre-injury MRI. Now, right here are the lateral ventricles. Can you see those? Here is the date of injury. Okay. Here is, excuse me, 1 day post-injury, 7 days. Just keep looking at the lateral ventricles. 16 weeks So what's that? That's about 4 months. See how the lateral ventricles have enlarged? And 2 years. So this is a really extreme case, but what happens is the ventricles tend to get bigger. It's interesting.
Are you going to say why?
Why? Just from the trauma. The trauma is so, I don't think they really know. I mean, they're still doing quite a bit of research.
Would that be because of die-off of other brain cells, and so the ventricles are taking up the slack?
That's right. That's exactly right. So it's die-off of other brain cells. I think, honestly, I think they're not sure why. This is like a new thing they've been figuring out. So the Sweden study in 2016 said that when a child hits their head, they have a higher risk of death, disease, and low educational capability. So the more traumatic brain injury someone has, they're at risk for having other health issues. And the older the injured person is, the long-term effects are more extreme. Children tend to bounce back better, so when someone's older, and we'll find out why, because why things don't work as great. I just turned 55. When you get older, why they slow down, and there's a lot you can do. Get cranial sessions and things like that. But this study was really interesting because they compared siblings who had TBIs and then siblings who didn't have them. So what has to happen for us to heal is we need to bring the autonomic nervous system, bring it back into balance. And that's what we are so good at doing, right? Jump up and down. We can do this. We are really good at this. This is like our strength. There are very few, I'm going to give you a little pep talk. There are very few modalities that are so good at this. This is what we got, people. So, really own that. Also, restoring lymphatics, cerebral spinal fluid, arterial flow, we're going to go into details of that, venous flow. Our work really influences that very strongly. That's why I love this work. We work with mobility, so, movement between two bones. We work with motility, how a bone itself is breathed by the breath of life, right? Those are such powerful things. Chiropractic can't touch this. Chiropractic doesn't work with motility, it works with mobility. We're the only profession that I know of that works with motility. So that's huge right there. These natural fulcrums are really important for the skull, the membranes, and the brain, especially Sutherland's fulcrum. I've given sessions with after a car accident, and Sutherland's fulcrum is, in front of the straight sinus, you have, where the tent and the falx intersect. That can get out of balance after someone hits their head or has an accident. And so just, orienting to the inherent treatment plan, that can kind of get back in its own power spot, basically, in alignment, and then the whole system will reorganize. And I've seen that happen quite a bit during sessions. The other thing we're going to talk about is methylation, which is not really what we do, but it's really good to know about with our work because it has to do with a process that the liver does biochemically to support neurotransmitters and detoxification and the energy cycle, the mitochondria of your cells and things like that. So that's an important piece to throw in because that can be the missing link. So here's some symptoms that we all know. You guys already know all this stuff, but it's autonomic dysfunction. There's some people that work with heart rate variability, heart math, that gets altered. Exercise issues, blood pressure, blood flow, sleep, digestive. This is a bit of a review, I bet. Medicine is starting to stimulate the vagus nerve. They're putting little stimulators on people to help people with lupus and RA and things like that. But we already do that with our work, right? There's the auricular branch right there of the vagus nerve. You know, you can make contact with the ear if you want and do one of the temporal bone holds and work with that nerve and helping that regulate. Also, just, you know, one of the holds I started doing, if you want, I could, if there's time after, I could show people, but I started kind of redoing the Sutherland's vault hold. Instead of doing it here, I'll just drop down onto the face. So I can hold the trigeminal nerve and the upper, you know, the upper cervicals and include them, and I've been getting good results with that. Hopefully Dr. Sutherland's not rolling in his grave hearing that, but. Here's some more intricate details that are important. Here's the jugular foramen that comes out between the temporal and occipital bone. And look at all the nerves that go through it. But this jugular vein is really important with concussions because we really want to make sure that it's open and draining really well, because that's what's pulling out all the debris from the brain. These are, you know, the different foramen that things pass through. It's good to have a sense of this or be able to look it up. There's the vagus nerve going through the jugular foramen, the glossopharyngeal nerve, the spinal accessory nerve. And what does the hypoglossal, this is a joke, what does the hypoglossal nerve go through? Who's in Grant's tomb? Okay, the hypoglossal canal. Yeah. Just a little nerdism for you. Here is the jugular foramen right there. Very important. Can you see right through here? That's the sigmoid sinus, and then that comes into the occipital sinus and the straight sinus. We'll look at those in just a second for the venous drainage. This I thought was fun to throw in, that cerebral spinal fluid transmits light. It's liquid light. I'm sure people have felt that, where you're working and you feel this liquid light. It reminds me of those bioluminescent bays that, you know, down in the Caribbean. I don't know if there's other ones, but where, you know, they just sparkle. It feels a lot like that. The CSF is really important because it's going to help with the debris. It's kind of the medium that the debris gets cleaned out with. And it's made mostly they're finding that it's made in the choroid plexus, but it also comes from the interstitial fluid between all your cells in the brain. So it's really in there, really deep, to do some vacuuming and cleaning. We really are fluid at our roots. These are just some facts. We have 150 milliliters in our brain, around our brain, the central canal, around our cord. It turns over about 3 to 4 times a day. That's significant, right? It's constantly cleaning, right? And makes about 500 milliliters. That's a half liter. So it's pretty significant. The structure of cerebral spinal fluid can change based on nutrition, exercise, and trauma. So it changes. Also, one thing I didn't know when I was preparing this was that there are hair-like projections called cilia that are in the ventricles that kind of move it around. I didn't know that. Did anybody know that? I bet Christopher and Mary Louise knew that, but. So here is a picture where they put dye in the jugular vein here. Okay, and this is pre-concussion, and then a person got a concussion, and can you see how it's diminished? Just show that to your neurologist friend. That's all you gotta do is show them that picture. Well, actually, you just gotta get them to get a session. So here's, pictures speak 1,000 words. So here, you know, the jugular foramen right here coming out between the temporal and the occipital bone. There's the jugular vein draining into the vena cava. And these are the different sinuses. So here's the straight sinus. That's where Sutherland's fulcrum is. There's the inferior sagittal sinus. There's the superior sagittal sinus. But the importance of this slide really is this, is to really, when you have a concussion patient, to really make sure there's a lot of mobility and motility in the cranial base and the upper cervical spine, because that really influences things. Here's the arterial flow. So the carotid artery goes through the carotid canal right here. Can you see it right there in the temporal bone? It's just, so the motility of the temporal bone could influence that, right? If the temporal bone itself might have some inertia in it, right? Now, I don't work this closely with people. I do follow the inherent treatment plan, but what happens is you're holding someone's head, and then it just kind of comes to you like, oh, there's some inertia in the carotid canal. Okay, so maybe the arterial blood's having a little trouble getting into the brain. You know, you want to get oxygen to your brain. Yeah, it's kind of important. So the other piece of this is that the vertebral artery, this is what chiropractors are, you know, people are afraid of us because of that. And I don't manipulate the neck because I'm afraid of it too. And I'm a chiropractor. This artery, can you see how it goes through all these vertebrae? And most of the rotation of your head happens right here between the atlas and the axis. It basically rotates around the peg